and welcome to this Facebook live session. My name is Dr. Neeraj Bhalla, and I am the senior cardiologist at BLK Super Speciality Hospital. I hope if you can hear me, will someone raise their hands? Someone can wave. If you can hear me. If everything is good, then we'll carry on. Right. Okay. So please, yeah. So if everyone can hear, then we can make a go for it. Okay. Okay, thank you Dia for waving. I think everyone can hear. So now we get started and get on to the topic of the evening. So the topic that I have chosen is heart patients need special attention in COVID times. Now, I'd like to divide this presentation in two parts, and we are going to first talk about what are the COVID times that are facing us. Secondly, what are the arrangements in hospitals, or what are the arrangements, or how should heart patients look or think about going and caring for themselves at this time. Anyone has got any questions, you can please post them in the chat box and I will try to reply. कुछ भी if you want me to speak in Hindi, मैं हिंदी में भी काफ़ी माहिर हूँ, बोल सकता हूँ. All right. So we are now in phase 4, 2 months into the lockdown. And what do we find? We find that instead of reducing, actually the pandemic is spreading in our country, in our cities. Every day we see the numbers are going up. And it is likely to spread even more as the economic compulsions demand that our country opens up and we need to get back into gear and learn how to live with the virus. This is the time for us to be extremely vigilant and to be Atmanirbhar, or care for yourself, as our Prime Minister has said. Because the government, the administration has got only a limited capacity, and we know that our country has got multiple issues regarding healthcare. So we need to be very vigilant to take care of ourselves that we do not contract this infection. We know the 3 pillars of prevention. I'm going to just repeat them for you. The 3 pillars of prevention are: number 1, social distancing; number 2, wearing a face mask or face shield; and number 3, frequent hand sanitization or hand washing. I know you may have heard this over and over again, but I think no amount of repetition can be enough for us to emphasize, because once you get this infection, then everything becomes unpredictable. Also important, I think, for enabling tracking of people, enabling understanding of the nature of this pandemic, the Arogya Setu map should be downloaded by all of us, so that it is possible for us to make sense of where this is going and what further measures may need to be put into place. So this is the perspective of the coronavirus pandemic that is facing us. How to be healthy in lockdown is a question Suraj has asked. मैं अभी बताने वाला हूँ आपको. Give me 2 minutes आप दीजिए. हेल्दी होने के लिए 2-3 चीज़ें बहुत ज़रूरी हैं. एक तो फिजिकल हेल्थ भी और मेंटल हेल्थ दोनों का देखभाल करना है. फिजिकल हेल्थ में जो आपके पास लिमिटेड एरिया है in your house, in your area around about it, 1 घंटा at least try to take out some time to do physical exercise. खाने पीने का जो सिस्टम बनाया है, try to eat healthy. जो भी choices अभी घर में ही हम बना रहे हैं खाना, so that itself is a very good healthy choice. एंड thirdly, try not to get upset अगर आपका बिजनेस नहीं चल रहा है, अगर आपका लोन आउटस्टैंडिंग है, आपकी दुकान नहीं खुल रही है. So look after mental, physical health as well as diet. I hope सूरज ये आपके लिए this is good enough tip. बाकी how to modify आपको खुद करना है अपने environment. So coming back to what is the perspective of the COVID-19 or coronavirus pandemic, how to prevent it. Second point is, how do we know we have coronavirus or what are the symptoms? ये भी easy है जानना. Fever, बहुत important. Cough with or without expectoration and a feeling of breathlessness without being distressed. इसका मतलब है that patients, this is why you see that temperature is being checked in many places. History of cough is being done, is asked. And third, many times we are finding that patients are out of breath but they are not distressed. जब हम oxygen saturation check करते हैं, their oxygen saturation is low but they are not distressed by it. This is a very dangerous sign because patients can become quite serious without realizing that they are facing such a severe problem, and by the time they reach the hospital or medical care, the disease is already far advanced. In hospitals, what we are doing is, as soon as a patient comes in with these symptoms, an X-ray of the chest is taken, and that gives us a lot of information about whether this patient has started having this problem. We also know that what are the investigations. As soon as we suspect this, we know that the main investigation to test this virus is a swab which is taken from the throat and also from the nose. I have had it done. It's not a very pleasant experience, and it also has got a 30% chance of being false negative. So sometimes repeated tests need to be done. This is why before you get into this, try to prevent it from happening. Who should be tested? Should everyone be tested? Ideally, yes, but then the more people you test, the more chances of false results coming are higher. So our country has chosen a path whereby people are tested if they have got history of contact with a patient, if they have traveled from from abroad, if they are showing any symptoms, or if they are in a high risk situation such as healthcare workers dealing with patients, or people who are in a containment zone where likelihood of coming into contact with these patients is high. So 3 steps of prevention: main symptoms and signs, and type of testing. This is all important for us to know. Once you have got, unfortunately, if you are reported to be positive, फिर करना क्या है? What do we do? You have to report to a center which is designated to take care of corona or COVID patients. This may be a government hospital or it may be a private hospital. Also remember, your tests will be shared by the municipal authorities, so you are likely to get a phone call or visits from several health authorities. This has happened to many of my patients. They will come to your house, they will sanitize around the house, they will put a label on your house, and once you go to a healthcare facility, depending on your condition, it will be decided whether you can be isolated at home or you need to be admitted to a quarantine or an observation center or to a hospital. So these are all the steps that come in case you are reported positive. Remember one thing: if you get this infection, then there is a lot of issues that come in. One, both mentally, both physically, and also there is a social price to be paid. So you have to be strong, your family has to support you, you have to be strong mentally, and you have to also undertake the physical treatment. So remember, this is not an easy infection. Unlike a normal flu, the course of this infection lasts almost 2 weeks or more. Many people are in hospital for 2 weeks, 3 weeks. So it's a long haul. The good part in our country is that mortality, people dying, people being seriously sick, is low as compared in percentage terms as compared to the rest of the world. But we are such a large population, and with the cases increasing, the chances of more large number of people being in hospital is very high, especially going ahead. What about the outcome? If you get this COVID, what is going to happen to you? Well, it depends on a few things, and this is going to nicely go into the next part of my talk, which is about heart patients in specific. So, outcome of patients with COVID is related to the course of the disease, and this may vary from being completely asymptomatic and full recovery to dying of COVID. There is a question, how is it decided how long to self-quarantine for, especially if someone is flying in from outside India? The standard quarantine time that the government of India is doing for patients or people who are flying in from outside is 2 weeks. And this is going to be self-quarantine in most cases, provided they will confirm from you if you have facilities for self-isolation, which means a special room, your own toilet, your own utensils for food, and place where your clothes can be washed or be washed separate from everyone else. So 2 weeks should be the time. So coming back to the course of the disease, as I said, it can vary from asymptomatic and to death. So हमें पता होना चाहिए that what are the chances that we might contract a serious form of this condition. And if it is so, then we need to be extra precautious, take extra precautions not to develop this infection. What about specific treatment? Well, specific treatment is another entirely different video. I think it's beyond the scope of this present discussion. So, level of pandemic, precautions, symptoms and signs, tests to be done, and also what to do in case you have a positive test I have told you so far. If there are any questions on these general aspects of COVID-19 so far, you can please feel free to ask. I'll try to answer. We now come to who are the people who are specifically at higher risk for developing the serious forms of the disease. Again, this is quite well known. Extremes of age, elderly people, that means people more than 65 or below the age of 10 years. This is why the advisory is that such age groups should remain at home as long as possible. Question has come about hydroxychloroquine as prophylaxis. The answer is that if you are in a high-risk profession like healthcare workers, for example, I'm taking it, but if you are not in a high-risk situation, you're not in contact with the patient, you're not likely to come, then there is no need to take it. But if you are to take it, it's quite a low dose, it's quite safe. I missed one more question, that after being discharged, if you're asymptomatic, what do you do? I think if you are asymptomatic from the disease, after a period of time, you have recovered from it. The government earlier used to say that 2 tests should be in succession negative before you're declared cured, but they realized that doing these tests, the tests may keep on coming positive because the RNA particles, even of the dead virus, are floating around and they may give rise to positivity for a long time. They said if you're asymptomatic, you have to self-isolate for 7 days and then you may declare yourself cured. If you have, it is very, very low, almost a zero incidence of recurrent infection in the same patient. It seems that the immunity that you develop is quite long-lived, and chances of the second infection or the infection coming up again is incorrect. There was a report from China and Korea where it was felt that patients are again showing positivity of COVID, but this was found that the viruses they were actually not active infection but RNA material floating from the dead viruses. So once the government has said if you're asymptomatic, 7 days no symptoms, you may consider yourself to be cured. Why they have removed the testing? Because they find that the highest amount of virus load is just before the symptoms come, And once the symptoms come, the virus load actually reduces, and within a week, the patient becomes non-infective. I hope that answers your question about hydroxychloroquine as well as this. Now, who are the vulnerable group of patients? So, extremes of age and those who have got other illnesses that are weakening their immune systems. And what have been identified is patients who are diabetic, patients who have got high blood pressure, patients who have got heart disease, patients who have got kidney disease, patients who have cancer. Along with this, patients who have got morbid, who are very obese, and patients who are smokers can develop a very severe form of this disease. So if you have got any of these issues, then you should be very careful about contracting the illness, because you might develop a very severe form of the illness. Okay, now heart patients, this is my specialty. I look after heart patients, and I have a lot of patients who are nervous, who are worried, and I think this might be useful to them. So how are heart patients faring in COVID times, and what should they do? Well, what we have seen in the last 2 months is hospital attendance has gone down drastically, both in the emergency as well as in the inpatients. The number of surgeries being done have gone down drastically. Now, this is most likely because of the lockdown. Movement was almost impossible, and also a scare. Since this week, since this Monday, as phase 4 of the lockdown has become much easier, much more relaxed, I have noticed, and everywhere, the much larger number of patients are attending the OPD, and this is likely to increase. This is a worldwide phenomenon. In fact, what has been seen is that the number of heart attacks that patients are reporting with, the time taken for them to report with a heart attack has reduced a lot. And the time taken for patients reporting with heart attack has actually increased, because there's a study from Hong Kong which said that before the lockdown, a heart attack patient would report to the hospital within 80 minutes or 1.5 hours. This is increased to 300 minutes, almost 5 hours during this lockdown or during this pandemic. Also, the incidence of patients coming to hospital with heart attack has decreased by about 40%. And this is not because heart attacks have disappeared. Heart disease is a lifestyle disease which has its own pace. It has got its own way of manifesting. And there may be 2 reasons why patients with heart attacks have reduced. Number one is that, again, patients are reluctant to come to hospital because they think that this is the place which has got a large number of COVID patients, which is correct. And secondly, the effects of the lockdown also might be working. So what are the effects of the lockdown? So remember, heart disease is a lifestyle disease, and these lifestyle diseases have got their behavior is modified to a great extent by what lifestyle choices we have. So the lockdown and this pandemic situation has changed our lifestyle quite a lot. So what is that? One is sedentariness has increased. That means that we are not able to go out. People are lounging around at home. They don't have space, they don't have the inclination, or they don't have the facilities to go and exert. Even simply moving around in the office, walking up and down stairs, talking to different people uses up calories. So sedentariness has increased. Calorie intakes has increased because, again, we are sitting at home, there's not much to do, so people are eating. But luckily, hopefully, choices of food have become more healthy, as we are not able to order in, not able to access junk food. So possibly calories have increased, but this is stress levels in some people have decreased, in some people have increased. Those who are in a high stress job, they have now nowhere to go. Their blood pressure has come down, the pollution has come down, and these are the people whose stress levels have decreased. But those who are not able to have open their stores, shops, those businesses who have had to lay off workers, those businesses which are looking at a long-term problem, definitely the stress levels will have increased. What are the long-term effects of this? Nobody knows. Nobody knows what are the long-term effects of this, but the long-term effects will have to do with changes in our social behavior, in our economic situation, and the situation that the pandemic leaves us in. So this is going to be a new normal. We are not going to go back to the old normal, and we have to adapt and understand before what is happening and how we can adapt to it. So what is the new normal that is emerging in the context of heart patients? Since the topic is of heart patients, let me talk about heart patients. Well, number one thing I see is less physical visits to the hospital. There's a wonderful question from Surinder Verma. What is home-based cardiac rehabilitation and how it could be used during COVID-19? I'll try to answer that, Surinder, in my next few points. So one of the changes that is going to be is less physical visits to the hospital or to the doctor. What I am finding is that there is a new trend for teleconsultation or telemedicine, and it has gone from 0 to almost 30% of consultations across the world have become now teleconsultation. Even India, which until recently teleconsultation was considered illegal, the government of India has passed an order in this month only legalizing telemedicine, legalizing teleconsultation, and what is the framework in which it is to be done. So that's number one, I think. Number two is home monitoring of patients by themselves, using wearables, using, for example, simple things like blood pressure monitors, saturation monitors, glucometer is going to increase, and that's all for the good. Because these lifestyle diseases should have a large amount of participation from the patient, and then only it is most successful. The patient has to take his or her own charge of the problem and work with the doctor. So this is going to encourage us to become much more self-reliant. So I think this is going to be good. Thirdly, in those patients who already have got implanted cardiac devices, many of these patients would come to the hospital for monitoring. Many of them will opt for remote monitoring options, and I think this is again going to be a trend which will impact the medical device industry, impact patients, and will enable better monitoring of patients. The next trend, I think, is medical care is going to become more costly for whatever reasons. So I will encourage everyone, especially heart patients, to increase or get life insurance and health insurance cover right now. I think going ahead, incomes are going to decrease and cost of medical cover is going to decrease. It's going to increase significantly. So please try to get health insurance for you as well as your close ones. Ikram Khan is experiencing taste and smell loss since last 1 week. Is it a potential symptom of COVID? Yes, definitely. One of the things that we have found is in India especially, I know a doctor friend of mine, the only symptom he had was loss of smell and he became COVID positive. These unusual symptoms such as nausea, loss of taste, loss of smell are very strong indicators that you might be having COVID. So please get yourself tested. So thank you for endorsing self-monitoring blood pressure machines. There's another comment on that. All right. So the second trend I foresee is that medical care is going to become costlier. All hospitals are now going to charge patients for personal protective equipment, for sanitizers and all which are required at this time. So patients will have to be ready to pay. So please increase your health insurance cover. The third trend, I think, is that healthcare facilities will be chosen much more for their health and hygiene practices, because everyone is going to become much more conscious of going to a place which is hygienic, and this is going to help or ramp up the uh, hygiene practices at hospitals. All healthcare facilities are trying to do this. They're trying to become more hygienic, have more sanitation facilities, both for the protection of the doctors and healthcare workers as well as for the patients. So I think what is going to happen is that we will be choosing places that are known to have these good practices. Fourth trend, I think, is that elective or lifestyle surgeries or procedures will go down. For example, joint replacement surgeries or cosmetic surgeries, because patients do not want to, will have, this is the trend that we will be seeing in the future. Essential surgeries such as cancer, trauma, or cardiac surgeries or cardiac angioplasties, which are inescapable, of course, are going to carry on the way. So what is not going to change? Again, we need to understand this, and especially in the context of heart patients. So I will say that the traditional lifestyle disease trajectory, as human beings, we are the same. So the trajectory of lifestyle diseases is going to remain the same. The requirement for continued monitoring, continued regular medicine, regular follow-up and investigations are going to continue. In fact, they are likely to increase. Those surgeries, like I said, which are unavoidable, which are emergency, which are life-saving, are going to increase or remain the same at least. So my suggestion to heart patients is that try to understand what are the trends of the disease or the changes that in the healthcare system that we're going to see. Try to come up to, try to preempt or try to anticipate these changes. Try to use this to your advantage. And this is how, going ahead, I think we will be able to manage in this very, very drastically altered scenario. I did not think this is a forum to talk about what is heart disease and what are the symptoms of heart disease and how we should know we are having a heart attack. I think that's beyond this discussion, and we are not going to gain anything, or I will not be imparting any great knowledge or not try to teach anybody regarding this. So I'll just conclude that this pandemic is changing our behavior in many ways. There are new patterns of lifestyle which are going to emerge, and we have to mix the old with the new to find a way to go ahead. There is a question to know need to know how safe it is to open my beauty clinics with all precautions. So this is again, as you know, the government has not yet allowed beauty parlors, salons, spas, and barbers to open their shops, because this all demands a very close contact with the patient. As far as these professions are concerned, my suggestion would be that you wait for some time, because you don't know where your customer is coming from, and you have necessarily to be in very close contact with them. The chances of you passing on or acquiring an infection is very high. So in the interest of your safety as well as your customer safety, I think you need to wait for some more time until the situation becomes at least steady. What that means is that, and if there is just a steady number of patients being added and that number is low, then maybe you could consider. But as we are seeing, the cases are increasing every day. In fact, the rate of rise is also more, regardless of what anyone might say. So at this stage, I will suggest that you should not think of opening at this stage. So I'll just end by saying that heart patients and all patients this is a time, which is a difficult time for all of us, especially those who need continued care. So I will suggest that a close connect with your doctor or with a hospital that you trust will help you in going a long way to sort out your problems or look after you and your family members as in this very difficult period. So I think with that I will like to conclude, and thank you very much for patient listening. There have been some questions and I hope I've answered them. कुछ और पूछना है, कुछ और भी बात है तो please feel free and go ahead. In case of any specific queries regarding your specific medical condition, if you want any advice, you're free to get in touch with me. I have been doing dispensing free medical advice to many of my patients. I did it for a month. Now I'm available on Teleconsultation. I'm available to answer your queries, and if there's anything specific, you are more than welcome to inquire for me. So I think we will call it a day, and thank you very much. It's getting late in the evening. All of us have tasks to do at home, and all of us need to get back into looking after ourselves. And thank you very much. Be safe, have a good day or have a good evening wherever you are. Thank you.